What I'd like to do is I'd like to just start off by again thanking our sponsors. You know, it speaks volumes to the level of support for this effort outside of public health. We were talking about that earlier. You know, Whitewater, World Aquatic Park, and Ellison Associates. You know, we reached out to them. Members of the board reached out to those companies and said, "Hey, we're doing this. This is important. We want to get as much as we possibly can from the group. It's hard for these people to travel. We want to be productive and wisely use their time. We didn't want to lose an hour to an hour and a half of everybody leaving, and so we went out to those companies and said, "Hey, would you help us out by giving us a little so we can provide this lunch?" And in my role, and I'll speak just for a minute before I get into the topic that I was asked to speak about. My role in this process from day one, and day one started with the Recreational Water Conference, I think you said 9 years ago, Michael, was that when we had that conference in Atlanta? 2005, 9 years ago, when I got a call from Michael, who I didn't know at the time, or maybe I'd met in passing, and asked if I'd come and participate, and been involved in this process since then. I've represented both my company, I've tried to represent all operators, to the extent that I can, though I personally and as a group, we've asked for other operators to get involved because my perspective is different than some others in the room, some of the people that represent smaller operators, and I recognize that. So we really do encourage others to get involved, but also I represent IAPA and World Aquatic Park, and it hasn't always been smooth sailing. There's been times through the process, and Francine, I'm sure, will nod her head, that they've been concerned, I think is to put it lightly, as to where we're going with this and what we're doing. And the fact that World Aquatic Park stepped up and sponsored the lunch, I think is a real testament to how far we've come and what we've achieved through this process and what we want to continue to achieve as we go forward. So with that, I'll continue on with what I'm here to talk about. So the proposed CMAHC working structure, I will stay close to the mic, I promise. Okay. So now we're here talking about standing committees. We've gone through this flow chart and gone through this process here. What I'm really here to talk about now is standing committees, and this is kind of the meat and potatoes. Earlier we got a lot of conversations about, well, how is this all really going to work? And there's 10 different ways this presentation could have been put together, and I thank all of you for your patience as we've kind of fumbled through this and said, hey, wait, we'll get to that, and we've gotten to most of it. This is one of the last pieces that kind of brings it together. We recognize that there's a significant amount of effort that's going to go into this, and the board, I think there's 11, 13, how many board members right now? 9? 10. 10 board members right now. We're not going to be able to do all this, and the intent is, and I wouldn't have signed up, Jim wouldn't have signed up, others wouldn't have signed up if our responsibility was to do everything. We were hoping that Doug would do everything, but that's not going to. Yeah, good point. But nonetheless, it's going to take the collective effort of a lot of people to make this happen, and it's not just the technical side; it's also just the meat and potatoes of making something like this work. So we're a not-for-profit. We applied for it, got our status. Well, certain obligations come with that. We've talked about donations and fundraising. So we're asking people to give us money. Good comments about making sure that with that doesn't come any implied responsibilities or implied in anything. That we're being good, but we're also being good stewards of that money, how we're using that money. So we're going to need an audit committee. Constitution and bylaws. We've already nominated our first member of the Constitution and Bylaws Committee. But that's an important point. We have bylaws for the board. You can't form a not-for-profit without bylaws. So we've put effort in. Don't think that we're just walking in the room here and throwing some stuff on the wall and said, hey, let's figure this out as a group, guys. There's a lot of effort's been put into this, meetings, people traveling, sitting in a room for multiple days, hashing through what's being presented here to the group. But we also understand there's work to be done, and so the Constitution and Bylaws is going to be an important part of that to make sure we get the details worked out. We go back to transparency, and we talk constantly about transparency. And for there to be transparency, there has to be bylaws, and those bylaws have to be published so people understand the process. It's in writing, and it's there for everybody to see. Issues committees. Nominating committee, the program committee, so the program committee being, nominating committee being for the nominating in both the, at the council level, but then also at the board level, nominating. The program committee, so it's the program for putting together the conference, or no, it's not. The program, I got rooked into doing this at the last minute. Remind me, Michael, what was the program committee for? Oh, these are CFP's committees. Guys, I'm sorry about this. I got, Bob Vincent was supposed to give this presentation this morning, and I found out I'm giving this presentation. So these are CFP's committees. I'm sorry. These are our suggested committees. I'm very sorry about that. I wish somebody would have flagged me. With all those committees that were just on that previous slide, those are, there's a lot of committees there. Those committees are ones that we as a group, we don't think we can support, we don't think we need to support coming out of the gate. And so the board, this is the list I do recognize. This is the list that the board came up with for committees that we think that we need coming out of the gate. Constitution and Bylaws, I described it. That's what, as we envision that committee. Nominations committee. This is nominations for both the councils and then also the board itself. Meeting planning, that's pretty self-explanatory. Sponsorship committee to go out and solicit the sponsorship and funding. Research committee, that is going to be a very important committee, we believe. That committee is going to be helping to drive the research agenda. So as the research agenda is developed, you know, it's all well and good. We can all develop a long list of research, but ultimately, how is that happening? How's it getting funded? And where is that research being done? And how is that research being prioritized? And then standards and code correlation. And that is you know, one of the things we're sensitive to, one of the things we're concerned about is other codes that are out there, and making sure that we're paying attention to that. And we're correlating. We're making sure that our document, the MAC, is responsive to and aware of what is going on with other codes that may conflict, may overlap, or may be influenced by what's being published with the MAC itself. We have talked about setting up an ad hoc committee for some issues we already know about. There's a couple of them that are pretty significant. One of them, it's very polarizing, has been very polarizing through the process, was stabilizers, isocyanates. I got it wrong. Thank you. Stabilizers. We know that there's a lot of concern out there, a lot of concern by operators out there. So we have identified some committees that we think is necessary to set up immediately so they can start to address those issues. Within these committees, we're suggesting 10 to 11 people. And by the way, this is all up for discussion. I'm just going through the points so that we can then open up the floor and have conversations about this. We're suggesting 10 to 11 people for these committees. Kind of goes back to the comment that was made earlier. You know, Francine talked about, I think 6 to 8 is kind of practical numbers. Then again, is everybody participating? We'd like some input on that. And then representation, chair and vice chair. We think that those two should be split. We're not saying that that it should be any one group is always the chair and the vice chair. But if you remember that pie chart, you know, if you were to split it in half, and by the way, we talked on the side here. Think about the public health being further subdivided. Next time you see it, it'll show public health further subdivided. But you know the chair and vice chair being split between the broader categories of public health and industry. And then we talked about there being, within public health, there being a minimum 4 representatives from public health. there being 3 representatives from industry and then 1 elected representative, which can come from either or consumer. So, and by the way, the voice or the comment that was made earlier about consumer, we would love to have consumer representation. We'd love to have a category. We'd love to have, you know, a real demand for that, and maybe that's something that we find a way to measure and identify and then be nimble enough to respond to. But we're concerned about what that really means when we say there's consumer participation. Who are those individuals, and how are they, where are they coming from? Are they really consumers, or are they, you know, members of these other groups that we've identified? So with that, we'd like to open it up for a discussion, comment. The bullet points up here are really what we're looking for input on, similar to what we did in the morning. So with that, yep.
Because I have to start it again. Rich Casiopo. Are you not, again, this is, I guess, a Socratic method where with town hall we can give our opinions and not look critical. Are we not putting the cart before the horse, having all these committees before the most important one is the bylaws and constitutional? Well, the bylaws are done, but they're going to be reviewed, aren't? Wouldn't the constitutional committee do that?
Yeah, that's good input. What I would say is, for that Constitutional Committee to be effective, they need this input. So even if that process were to happen, and it's a good point, and that committee to go first, and for them to develop that Constitution, this is the input we need for us to do that.
They're just giving research and information, rather, that they'll give to the ultimate committees that are formed by the bylaws, by the revised bylaws.
Correct. Correct. Yes.
Hi, Epi Torres from Hydroware. I'm concerned that obviously one of the critical factors for this whole process is adoption, right? And we heard something like 10 years for that other code. I don't see here any committee person or metric to drive that. So
I'm sorry, to drive what?
Adoption of the
Adoption
code.
of?
Yeah.
Okay.
Marketing committee.
Yeah. That's good input. I acknowledge that. Michael?
Sorry, I'm still eating. The purpose of the conference, is to keep the MAC updated, is the primary goal. As I listed the goals earlier in my talk, one of them is to advocate for health and safety and advocate for improvement. Now, we are a 501c3 nonprofit. We cannot lobby. We can advocate and we can explain, we can assist, and we can help. But I think for the public health people in the room, this group is not going to get people to adopt. That's going to be the state or the local folks that are going to decide that. We are going to be assistants and consultants to help them do that and help them understand the MAC and what the differences are. The biggest thing now is, can we line up codes, my state code or local code, against the MAC and see what the differences are, so we can start to see how to change things. And so that is one of the goals, but it's not one of the primary things that we're talking about today, which is how do we operate and organize this meeting and do the updating and everything. But that is one of the goals of the CMAHC and of CDC. We're a federal organization. We can't lobby to have anything done, but we're doing our best to make sure that our partners know about this, know where it came from, know what's behind it, and see us as a tool for assistance when they ask questions about what they can do with it and that sort of thing. And we're already in those conversations. Does that address your question, or?
Well,
I'm not sure where
it doesn't, in the sense that I have a business hat on and thinking all of this effort, all of this, well, some of it public funding from the CDC side, and what if 3 people adopt this? I mean, it doesn't make any sense. So that's actually putting a citizen's hat on that. Thank you.
Yeah, so again, just to clarify, who do your industry or?
Epi Torres, we're developing a software package to support the
Perfect.
Yeah.
So you're it, which is you can lobby. Your industry. You support this 100%. Why aren't you talking to your state health department? And so health department, legislators, everything else saying, this makes sense to me to see this adopted, our industry will not resist putting this in place. In fact, we will support it if you do it. And so that's, many of you in the room can do things I can't. From a lobbying, sorry, I'm starting to walk around like I'm a nightclub thing. Sorry, I know I'm supposed to stand back here.
But this is in the best interest of the citizens and the the patrons of the facility.
You've made a wonderful point. This is in the best interest of every swimmer in this country.
Yeah,
so get out there and you do the lobbying, we'll do the advocacy and assistance.
All right.
Okay.
Buy Hideaware.
Okay, thanks.
Others? Oh, there we go.
God forbid I not say anything. For the technical committees, for the councils, for those kinds of things, I think it's good to have a strong, at least 10-person committee with equal representation. With the CFP that is, 3 times this size, with the board that's 2 times this size, we have the standing committees that are 2 people, 3 people. Okay. They can all be from industry. They can all be from health departments. Those kinds of bureaucratic standing committees, it's not important really to have equal representation, and it's not important to have 10 people. You need a few people that are going to get the job done. That's my input.
Okay, thank you.
That's a really good point, actually. I hadn't really thought about it. So who else? Give us some other comments on that. Does that make sense to you?
Yeah, is there concern in the room? Now, I'll voice a concern. If the Constitution and Bylaws Committee, I think, is one that probably needs a little more representation to make sure that that document that's being developed has a broader input. I don't know if you would agree with that or not for that one committee.
Well, all recommendations from that committee go back to the board. The board has to make the recommendation.
True, that is, okay. All right, you guys are making me feel bad here. You guys had lots of questions, lots of debate for the other presenters. I stand up. Yes, I stumbled, okay? You know what? I stumbled a little bit, okay? Come on, guys. You got to have some input, some comments on the. Frankly, this is pretty straightforward. There's not a lot to debate here, but thank you, Francine.
I'm Gwen from Richmond, Virginia. You made the comment on standing committees, you'd only need 2 or 3 to make the decisions. As I actually consider myself in the end user group,
Okay.
because we are the ones that are on the front line. We are the ones that are faced with implementing this code with each facility that we interface with. And I think you need to have us on the committees because you make a decision that I'm currently studying the issue of UV light with crypto. A lot of the pools we handle cannot afford UV light, and we desperately need it.
So I'm sorry, to be clear, your public health?
End user managing pools.
So end user, so owner operator.
I don't know if that qualifies, but
Well, I mean, this is the feedback we want. That's our intent. Our
Okay.
intent as the end user, you're the operator. You're the person that's actually out there running the facility.
I am on the pool side.
Investing the capital, managing the facilities. That's who we're trying to capture within the owner-operator category.
and we're small facilities.
Okay.
I'd only say a comment here. I actually don't think that's what David was actually saying, is that if you look at these kind of operational committees, what he's saying is it doesn't need the representation quite the same because it's going to go through other groups. It's not about technical review. It's not about change requests and that. That is a different type of beast. This is more about operational. Frankly, on sponsorship, we need industry people to be 100% on that and out there and getting sponsorship, really, because employees can't ask for it and that. So it's more about these operational things where we can make some decisions very quickly versus making key technical issues like that, which are the other committees.
Francine.
Francine from Whitewater. Just a couple of comments. One is that I get concerned when there's 200 members and now there's going to be like 12 committees, and then trying to populate those committees with
Yeah.
a lot of people.
Yeah.
And then trying to manage all of that. So I would make a recommendation, though. There's some things here where, like your constitution and bylaws, absolutely critical. But once that work is done, it's probably going to be managed by the CMAHC board. And because then at that point, maybe it's going to be reviewed periodically. And I would also say that nominations at one point may become a function of that board. But meeting and planning could probably be bundled with sponsorship. So you may find some ways where you can kind of consolidate those so it's a little bit more manageable.
Okay.
I do agree with the other comment about having an outreach committee, because as much work as we all put into it for 7 years to not have it be adopted, and be adopted not only domestically but also internationally, I think it's a great body of work, and there's a great opportunity to be able to take it even beyond where we're at.
And I'm going to show my ignorance here just for a minute, and I want a point of clarity with Michael. You had mentioned that the CMAC can't lobby because they're not for profit. Is that a correct statement?
Yes.
I thought, okay.
Otherwise, you lose your tax exempt status. So
Okay.
don't use the word lobby, advocacy. We advocate for things. We advocate for public health and safety and that sort of thing.
Okay.
So-
And just a last comment on that relative to the lobbying issue. I think that lobbying is something that may happen by individuals, but giving people the knowledge and the means to be able to do it is completely different. And I think what ends up happening is groups come together and they want to have their voice heard, but they don't know how to. So when I say that outreach, it's really a facilitating.
And that's good input, because what we have done already as the board is we've been contacted and asked by various groups to come and speak, and the board has come together, and we've got a process in place at the board level to approve travel and to send somebody representing the CMAC to that group. And Michael, you can speak. I don't know who we've spoken to.
Yeah, I mean, I think it's a combined role from CDC and a CMAC standpoint, but I think two of the big key groups are the National Association of City and County Health Officers, representing over 3,000 local health things, and then the Association of State and Territorial Health Officers. They've been briefed on the MAC all the way along. They're now fully on board. NACCHO will be working with us to understand, basically promote the MAC through their membership, as far as, I shouldn't say promote, inform their membership about what's going on and everything. Those are the two key groups that are going to do something, as well as National Conference of State Legislatures. And so they're all on board as far as knowing where we're going and what we're doing. And then, again, we have to keep pushing this through presentations and all sorts of other things as well as including all of you in this. So it's probably, at least on the public health side, you may not have heard as much about this unless you're an environmental health person, because we're really trying to get the health departments to understand what this is and why it's come about and all that sort of thing. So if that addresses that. Go ahead.
Yeah, I just wanted to the prior comment that the lady just made, this is Epi Torres. I think what she was talking about is that committee that, and I'm hoping that this is what she meant, so I wanted to clarify because I thought it was a good point. Ease of adoption or implementation committee, meaning that looks from an operator's standpoint at the code and its feasibility, if you may, practicality. Is that, I just wanted to bring that back up.
Did you want to just say?
I think I was more thinking about groups like the associations that are saying, hey, this is a great idea, but I want to be able to go to my local government or my federal government to say, yes, I like this, and yes, we want this to be adopted. Groups don't always have the resources to know how that process works, and so sometimes you just need to give them some tools to use to do that outreach. But your point is well taken about how do you use the MAC. That's an excellent tool, and I think absolutely that's going to be needed.
Over here. This is Jason Coons here from CDC. I would say that point is very well taken. The CDC is committed to helping the users understand how to, sorry, I was told to speak a little closer to this, but Yeah, the CDC is certainly committed to providing resources for how to use the MAC, and you're going to see an increased emphasis coming in the next 6 months to a year in terms of training for inspectors and others on how to use the MAC. We recognize that we need to understand what are potential barriers to adoption and implementation, and we're working with our public health partners to try and understand and learn from what those barriers are. So we are making a commitment towards those end users of the MAC.
I'm going to share a story from an end user that grew up in aquatics and ended up having this as a career, because a lot of us end up that way. And first, I want to say the people that I work with in Oregon from the Oregon Health Authority are amazing. They always keep us in the loop and what's going on. But most pool operators in the U.S. are 18 years old, college student, in the summertime. They have no clue this is even coming. When I was in high school supervising a pool and had a health inspector come on the deck because we just opened a brand new outdoor facility with a food and beverage area, I was just lifeguarding. I was not the person running the show. He looked at me like I was really stupid, ignorant, and he said, "It's in the health code. You should know that." I'm a high school lifeguard. How in the world would I know that? So I suggest, because you guys are looking for suggestions, grassroots marketing should be a standing committee. You guys should be out there, all of you in this room. Any pool operator you meet, you need to be mentioning it to them. They don't know it's out there. And adoption, great, but I think it's even more just educate them. People are smart, they'll figure it out, they'll pull it out. That's what I did. Find everything you can. They can't come to conferences, they're not part of the conversation, but they're the ones that are going to be affected every single day on the job.
Yeah, Ron George, just a comment here, similar to what Francine said. What you've got up there is basically a management team that you're organizing with those. Those aren't committees that are going to deal with, the bulk of the meat in the Model Aquatic Health Code and technical committees and everything. It's not about a numbers game up there. It's about having some key people that are good at doing those certain tasks. And if not, you're going to have, with the membership we have, you're going to be looking for members to be on 3 or 4 committees, and that's just not going to work out in being effective and everything. So I don't think it's a matter of numbers at all, whether it's nominations or marketing planning. It's a couple key people, no matter what industry or what sector they're in, that know how to do that and be able to manage that task rather than trying to divide it up among all the different sectors.
And, thank you. I mean, we, going back to the slide I fumbled on, this was the, this was back to CFP, the template, the number of their standing committees. We recognizing the issue you're addressing, focused on how, what do we really need? But what we didn't talk about, and point well taken, is, okay, now within those committees we really need, how many people do you really need within those committees? So thank you. Other comments?
John.
Thank you.
A quick question. When we get into the more, I guess, maybe controversial issues like the Sanger rates and whatnot, are minutes going to be taken from these committee meetings so everyone kind of knows what the thinking was of the committee?
So that's a research agenda. So that falls under the category of research agenda. I think that's part of the Constitution and bylaws and part of the and then part of the research committee, the direction they give those ad hoc committees that are formed to go, they need to give that direction. That, I don't think we've had any conversation about that, but that would obviously make sense, that information is out there. Their findings are published and available to the general public.
Yeah, it's Eugene Knight from New Mexico. I'm backing up just a little bit. A while ago we had this discussion. People were worried, is anybody going to adopt this? New Mexico is in the process of adopting the Model Aquatic Health Code as we speak. So, and I don't know how many other states here are doing that, but there's going to be one. I mean, I'm looking at a year to get it done, but we're going that way.
There's a whole bunch of us that have put in a whole bunch of time. They're very glad to hear that. Thank you.
Can I say one thing? Thank God you said this, because everybody keeps asking, who are the states that you know about? And we're not talking about any of the states, because that's their business, and if they want to talk about it, that's great. Because we do have a number of states that are considering and thinking about this, but it's not our role to say who they are. That's a private situation with the state to decide how they're doing it, and they will release it when they want to. So thank you, because I can say that now you said it publicly, so I haven't mentioned it. So.
Okay, other comments, questions?
I just wanted to, Kyle McCauley, Larkin Aquatics, we're consultants, designers. Just back what she said earlier about the grassroots. A fair amount of our projects are small communities, rural communities, that is actually operated probably by the public work director, who the pool is under. So trying to get the word out to them that this is out there is just as important too.
Yeah, one of the venues that I think there was actually a good article that was just published. What was the magazine it was just published in a couple days ago?
Athletic Business.
Athletics Business. Okay. Messaging through things like that will be important. We know that across the country, these codes are adopted at various levels within the organization, sometimes at the state level, sometimes at the county level, sometimes at the local level. And, particularly when it gets down to the local level, it can be, the conversations that happen at the Rotary Club are the conversations that can influence whether or not it's adopted. And the more people that know and see the MAC in a positive light is going to benefit all of us and benefit adoption of the MAC. So you're absolutely right. Those comments are well placed.
I got this
Oh, I'm
thing
sorry,
here.
we have
I
one
got
right
the,
there.
I got the floor here. This is Don with Paddock again. Just to go back to where we were in New Mexico, in this room, there's probably a lot of folks that have been asked to participate in implementing this code in states, okay? And I have been, okay? And Indiana asked me to. I was very reluctant initially to do it, but it's coming, and if it doesn't get implemented properly and we don't take some time as a group and help do this, it isn't going anywhere in a good way. So, you know how the deal is. If you live in this country, vote. If you want to be part of the change, participate.
Thank you. There was, over here, there was.
Rich Cassiopolo. One of my biggest concerns along this is how this is going to be implemented. Just a quick question and then a comment. Is there going to be any type of ranking of the importance of each of these thousands of regulations within the code? Like, for example, if it was a criminal thing, and I've practiced in California, and there are felonies, misdemeanors, and infractions. There's so much here. How is it ever going to be enforced? Is there any kind of ranking? That's the first question.
I'll start with one comment, and then I'll let Michael jump in here. But it's no different than other state codes that exist today. If you look at Florida and I'm most familiar with, but other states, they're voluminous. There's lots of information there, and so this is like any other code. There's a lot of information here that's all relevant to public health. So, but specific to your concerns.
Normally, that's not the way that codes work. Within the code, the code is an entity. Within it is one section, if that's what you're referring to, is a listing of public health hazards that would result in closure and that sort of thing. And so maybe that's addressing kind of what you're saying, that under these circumstances, you're closed.
Okay, that was my point, but a code means nothing unless there's some kind of penalty for violating it.
Right, but that is not but that's not the job and not the effort of the MAC and the CMAC going forward. That would happen at a jurisdictional level. So at the state or local level, they would make the decision on how to implement and what penalties go along with compliance or not. Again, the CDC is not a authoritative regulatory body. They instead are putting forward a guideline for states to adopt as they see fit and how they see fit.
Yeah, correct. Any regulators want to speak to
as a previous regulator that it would be based on the state or the local jurisdiction and how they adopt that.
Pete Caligari again from Baltimore. There's another model act which enforces it. It's called the Administrative Procedures Act, which has all the various rules with respect to witnesses and evidence and testimony. And then at the end of that, there's a finding by the local hearing officer, and that hearing officer then promulgates to some extent or orders to some extent the closure, because you can appeal the decision of the local health code and ask for a stay of the enforcement. So that's the key to understanding that this is a model law, which we're hoping will be implemented by people who care enough about the water to actually, like for instance, there's one quick story I'll tell you. I'm the shower sheriff at the local facility, and I ask people to shower off before they get in the water. It's hilarious. Well, I can tell you, one lady getting into one of the water exercise classes looked at me, she goes, "Are you making trouble again?" So it's a comprehensive difficulty, and we laugh about it all the time. But that's the answer to that question. It's the Administrative Procedure Act which controls it.
Along that line, for those of you who remember way back before first edition came out, but there was a regulatory section that had a lot of language that was essentially administrative language speaking to pool programs. And it's not that people, I'm looking at Steve because boy, he had a lot to say about that. And not that he didn't necessarily like it, but that it had no business being in the MAC. And so all of that language that spoke to pool programs from an administrative code standpoint has all been removed. It has not died. We're working on it now. Jason's been through it. We will be posting that for public comment. I'm not saying when because I'm not quite sure, but that's going to come out. But again, it will be separate from the MAC. We want public comment on it, but it will be essentially for pool programs to advise them on how they might operate their programs and that. Because the reason we removed it is you can't regulate the regulators through the code essentially. And so this is now kind of administrative guidance for how to build a pool program and how to do that efficiently. Because part of the process that we've talked about here was that when we first started this back in 2005 is don't just tell pool operators what to do. We need to tell pool programs what, it's both sides of the fence here. And so we need to speak to what needs to be improved in pool programs just as much as we do thinking about design and construction and operation and that. So we speak to regulators and to the others, but it just isn't part of the MAC. We didn't want to hold things up to launch the MAC, but that will be coming out as well in the next 6 months. Oh, and in that will be we've gone through a model inspection form, and that is that what we find is that, a lot of data being collected by pool programs is essentially not very useful, and it's not being gathered in a way that can be used for decision making. And so we have model forms and ideas about how one would collect these data so that it actually would be more useful for everyone from an analytics standpoint, from a decision making standpoint, and everything else. And that will kind of dovetail with the CDC effort where one part of the house is essentially we're looking at screening all of the legal databases that we have algorithms going through there, looking for key MAC element adoption. And on the other side will be a Sentinel site surveillance system where we're working with top states and top counties that will kind of monitor before and after adoption, looking at the initial measure will be pool inspections, closures, and other key elements. Is that if you adopt the MAC, does it reduce some of these issues from a closure standpoint and public health hazard standpoint so that we can get data to show what is the impact of this model law over time. I think that's critical that we don't drop the ball by just saying it's out there. We've got to update it, but we also have to measure impact. And so Michelle Halavs is setting that up in the legal part with Jason. And so I think that will be coming in the years ahead as well to try and monitor what's going on.
Good afternoon. Jennifer Lee with the National Association of County and City Health Officials. Just circling back to the standing list of committees here. So one thing that I see missing is membership. So I don't know if that ties in with some of the other comments about outreach and communication, especially if you're going to talk about the differences in members and membership. The other thing is sponsorship, I usually think of as, associated with events, so maybe expanding it to finance and talking about funding and budgeting.
Okay, thank you.